Non-celiac gluten sensitivity, celiac disease, gluten intolerance versus gluten allergy. What does gluten do? Gluten is a sticky substance that allows ingredients to bind together well, giving an airy and chewy texture to breads and other baked goods. People who are intolerant to gluten suffer from celiac disease. Celiac disease is an autoimmune disease that attacks the small intestine and occurs in genetically predisposed people. It is estimated that it affects 1 in 100 people. If a person with celiac disease consumes foods containing gluten, it triggers an abnormal immune response that causes inflammation and gradual destruction of the villi in the small intestine, disrupting the absorption of nutrients into the bloodstream. You see, villi are finger-like projections on the surface of the intestine that absorb nutrients. If a person with celiac disease eats a food containing gluten, it affects their intestine, which can no longer absorb enough nutrients. Common symptoms include inflammation, abdominal pain, bloating, gas, constipation, diarrhea, fatigue, depression, and unexplained weight loss. However, the degree of severity of the disease and the intensity of the symptoms vary from one person to another, ranging from mild to severe. Please note that wheat gluten is much more aggressive than oat gluten. Diagnosis of celiac disease. If the disease is strongly suspected, your doctor will prescribe a blood test to detect specific antibodies against gluten. In celiac disease, levels of specific anti-gliadin IgE antibodies are important for diagnosis. If IgE anti-gliadin antibodies are present in sufficient quantities in the blood, the immune system reacts abnormally. The diagnosis must be confirmed by a biopsy of the small intestine. Small bowel biopsy remains the gold standard test for celiac disease detection. A small sample of the intestinal mucosa is taken to check the appearance of the villi to identify the nature of the problem. You should never start a gluten-free diet before having done the blood tests and biopsy, because the diet can distort the diagnosis. In the case of gluten intolerance or celiac disease, the inflammatory reaction in the small intestine causes damage to the villi in the small bowel and can lead to total villus atrophy, the destruction of the intestinal villi. However, in cases of gluten allergy and non-celiac gluten sensitivity, the intestinal mucosa does not show any lesions. Consequently, intestinal biopsy helps to remove all uncertainties in order to make an accurate diagnosis. Whether you suffer from gluten intolerance, celiac disease, or a gluten allergy, the only current treatment for either disorder is lifelong adherence to a gluten-free diet. People with non-celiac gluten sensitivity do not need to be as restrictive when it comes to gluten. Some gluten consumption is acceptable up to the level that causes symptoms like abdominal pain, bloating, and fatigue.